everybody, it's week 6 for Oscar's chemotherapy today. So this is actually pill day again. So he's getting something called cyclophosphamide. This is a medication that we have to make sure doesn't hang out in his bladder. It's excreted in the urine. So he's also going to get 3 tablets of something called Lasix or furosemide. And that's a diuretic. So he's going to be peeing like crazy. So he's going to go outside every hour here to go pee-pee. Because this drug can cause what's called a hemorrhagic cystitis. So basically, fancy word for a whole lot of blood and inflammation on the inside of your bladder. And as you can imagine, that doesn't feel good. So he's still doing really well as far as his blood counts. He still has got some low-level anemia. Come on. He is ramped up today. That's mommy's hand. I'm wearing special gloves again because it is a chemotherapy drug. You don't want it to touch your hand. This is the Lasix.
Easy.
Nicely, Easy. He just tried to goose one of our cats here. He was just like so excited. But you can see, again, because a lot of times a big concern, everybody doesn't want to do chemotherapy because the perception is my dog's going to act sick, they're going to feel bad. He's not acting sick. He doesn't feel bad. He's actually been on overload of his naughtiness as of lately. So other than the facial paralysis we're dealing with, he's doing great. You can see he does drop some food. He's doing great. So I'm so pleased and so happy with how his treatment's going. He has another 2 injections that we're going to do, or another 2 treatments, and then he actually starts every 2 weeks after that. So we've been doing weekly chemo treatments. He'll go to every 2 after that, and then we're going to continue to monitor him. So everything looks good. Okay, mommy's hands, not for food. So otherwise, this is another successful week of chemotherapy.
The camera?
Thanks for following along, guys.
Yay, chemo!